And the 5 body pains you should never, ever ignore. We'll tell you what they are. The doctor's got the information coming up.
Hurts so good. Come on, baby, make it hurt so good. Sometimes.
24 minutes after the hour, we've all had headaches or stomach pain, but the very ailments we may consider to be minor could serve as signs that something far more serious is wrong with our health. Here to reveal the 5 red flags we should not ignore is physician and surgeon Dr. Kelly Powers. Dr. Powers, thanks for being with us.
Thanks for having me.
Now, first up, you say jaw pain. It's not something that we ought to ignore because it could be a sign of a heart attack?
Absolutely, absolutely. Warning sign, huge red flag that your body is telling you. So jaw pain, although it could be other things, it could be related to trauma or dental caries, but specifically if it's associated with chest pain or left arm pain, don't ignore it.
Particularly if we have a family history of heart attacks.
Absolutely. Family history plays a huge role, and specifically if it's moving around where you really can't pinpoint exactly where it is, and if it waxes and wanes. So it's strong and sharp and then it gets dull. Bring yourself to the ER, get tested, cardiac enzymes, EKG, rule out that heart attack.
Okay,
right
next
there.
up, morning headache. Sometimes this happens to me if I haven't had my coffee, but this could be a sign of what?
Well, this could be a sign of a brain tumor, but you know what? They're very rare. Good to know. Does not occur often. However, this is not your, had a couple of cocktails the night before headache. This is something that occurs chronically. The key word is chronic.
And
this
if
is
you have
happening every
numbness
morning.
and tingling, loss of motor skills, things
Exactly,
like that.
exactly. So bring yourself to the primary care, get checked
What about
out.
leg pain?
So posterior leg pain specifically, and even more specific, unilateral, meaning one-sided. If you have pain in your leg, swelling in your leg, it could be a sign of a deep vein thrombosis, which means a blood clot. Blood clots could be stationary. If they move and travel throughout the body, they can get enlarged in the lung or the heart, brain, and cause a stroke and even death. So it's important to get checked out. Venous Doppler, present to your podiatric surgeon or your vascular surgeon.
Okay, next up, pins and needles.
Pins and needles, lower extremity, even in the hands. So this can be a sign of diabetes. According to the American Diabetes Association, about 30 million people in the U.S. have diabetes. According to the CDC, about 9 million of those 30 million are undiagnosed. So if you have pins and needles, bring yourself again to the podiatric surgeon, vascular surgeon, primary care, hemoglobin A1C, quick test to get tested for diabetes.
Yeah, this is just if you've been sitting around crossing your legs or fell asleep on your arm, and it's also associated with weight gain and thirst. You may want to get it checked out.
Absolutely, absolutely.
What about severe stomach aches?
So severe stomach aches, specifically in between the navel and the breastbone. If it's occurring right in this area, this could be a sign of a gastric ulcer, especially if you have nausea in the morning. Definitely bring yourself to the primary care physician. It's a good thing to get checked out for sure.
All right, we don't want to ignore these 5 things.
Yeah.
Dr. Powers, thank you so much.
Thank you for having me.